When an emergency strikes out in the wilderness, our first instinct is often just chaos. Your adrenaline spikes, panic can start to creep in. But what if you could swap all that chaos for calm, systematic control? Well, in this explainer, we're going to give you a really clear framework to assess and manage an emergency scene, turning you from a bystander into the most effective first responder you can possibly be.
Okay, let's dive right in. Here's the roadmap we're going to follow to get from chaos to control. We'll kick things off with the absolute number one priority, safety. From there, we'll get into how to prioritize injuries, how to handle multiple patients, how to track their condition, and then finally, we'll bring it all together into one simple, systematic plan. I want you to just picture it. One moment, everything's totally fine. The next, you're staring down a serious incident. The natural human response is this whirlwind of emotions and this really powerful urge to just do something. But the thing is, acting without a plan can make a bad situation a whole lot worse. So what is your first move? If your gut instinct is screaming, run directly to the injured person, I want you to just pump the brakes on that thought for a second. The most critical first step actually happens before you even get close to them. It all starts with one core principle: safety first. I mean, think about it. You can't provide any effective care if you end up becoming a second patient, right? So the very first step in bringing order to the scene is to think through 3 key factors before you take any action at all. This is your first decision-making filter. Number 1, yourself. Are you safe? Have you put on your gloves? Number 2, the environment. What dangers are lurking around? And only then, after those 2 are clear, do we get to number 3, the patient. For example, let's say a guest is injured near a nervous buffalo. Your priority isn't the guest's sprained ankle, it's getting yourself and the guest away from that animal. You always secure your own safety and the scene's safety first. So what are we looking for in the environment? Well, you need to use all your senses. Look, listen, and even smell for hazards. Is there a dangerous animal nearby? Are you on a steep, unstable slope? Is the weather about to turn nasty? You have got to identify and manage these threats before you can effectively help anyone. Okay, once the scene is safe, now we can turn our attention to the patient. But here again, we need a system. It's so easy to get distracted by a really dramatic-looking but non-lethal injury, like a broken bone, while completely missing something far more serious. We have to find what kills first.
So we do this in 2 phases. The primary assessment is absolutely laser-focused on immediate life threats. We're talking catastrophic bleeding, blocked airways, and somebody who isn't breathing. Think of this as saving a life. Once those big things are handled, we move on to the secondary assessment. That's a systematic head-to-toe check for everything else. This is about saving a limb. Life first, then limb. This is a simple rule that you need to burn into your memory. During that primary assessment, if you see severe, catastrophic bleeding, that is your absolute number 1 priority. Everything else has to wait. You have to stop that blood loss immediately. And this all brings us to a really critical concept, the golden hour. It's this idea that a patient's chance of survival is greatest if they get definitive medical care within about 60 minutes of the injury. Your actions as a first responder, controlling the scene, stopping that bleeding, managing the airway, make you the first and arguably the most crucial link in that whole chain of survival. All right, but what happens when there's more than one patient? The chaos just multiplies. This is where we need a system to sort the patients and a really clear protocol for calling in professional help. Calling for help when you're unprepared is a huge mistake. You've got to be calm and clear. Just follow these steps. Say who you are, exactly where you are, what happened, and how many people are hurt. And this part is crucial. Ask the operator to repeat the key information back to you to make sure they heard it right. And always be the last one to hang up the phone. So for multiple patients, we use a system called triage. It's a French word that basically just means to sort. It's a fast way to do the greatest good for the greatest number of people. We quickly check each patient's circulation, airway, and breathing and give them a priority. Red means they have critical life threats. Yellow is serious, but they can wait a bit. Green are the walking wounded, and black are for those who are deceased or have injuries that just aren't survivable when you have limited resources. So after we've managed all the immediate life threats, our job kind of shifts from intervention to observation. We need to get a full picture of the patient's condition and keep a close eye on them for any changes. This is where checking vital signs becomes absolutely essential.
The best way to think about vital signs, they're like the gauges on your car's dashboard. They tell you how the body's essential systems, the vital organs, are doing. We check their level of response, their breathing rate, their heart rate or pulse, and their skin condition. Is it pink, warm, and dry? These signs give us a constant stream of information about what's really going on inside the body. Now, you might hear about professionals using a tool called the Glasgow Coma Scale to get a more technical measurement of a patient's level of response. It scores things like eye-opening and verbal responses. But for a first responder, the main takeaway is this. Your job is to notice any change in a patient's awareness or responsiveness and make sure you report it. So, how in the world are you supposed to remember all of this when you're under pressure? Well, the answer is you don't have to. Instead, all of these concepts, the safety checks, the assessments, calling for help, they're all built into one single master framework that you can follow every single time. And here it is, the 12-step treatment algorithm. It's basically a repeatable checklist that makes sure nothing gets missed. Steps 1 through 3 are all about managing the scene. Check for hazards, say hello to check for a response, and call for help. Then, steps 4 through 6 are the core of your primary survey. Circulation, airway, breathing. If they're breathing, great. We move right on to secondary care. The head-to-toe survey, treating for shock, monitoring vitals, and providing ongoing care until you can hand them over to EMS. And what's so great is that by just following this system, you automatically sidestep all those classic, dangerous mistakes, rushing in without checking for hazards, moving a patient when it's not safe, getting totally distracted by a gory but minor wound, and fumbling that critical call for help. The system is your safety net. All right, so if you only take a few things away from this, make it these 5 points. Safety always comes first. Find what kills first with that primary assessment. Use triage to sort out the chaos. Call for help like a pro with all your info ready. And when you're in doubt, just trust the system. That 12-step algorithm is your guide from start to finish. Okay, before we wrap this up, let's do a quick knowledge check. Can you name the 3 factors of scene safety? And can you name the 4 color-coded triage priorities? Go ahead and pause here for a second and see if you can answer. It's seriously the best way to lock in what you've learned. The answers are responder, environment, and casualty. And the colors are red, yellow, green, and black. You know, at the end of the day, you can have the fanciest first aid kit in the world, but it doesn't matter if you don't have a plan. The ability to stay calm, to assess the scene, and to follow a systematic plan, that is the single most powerful tool you have. It's what brings order to chaos and gives your patient the best possible chance of a good outcome.